Hey guys, come along with me today to do a patient's full face tox. As you can see, I'm starting off with that frontalis. I marked those lateral borders of the frontalis. I like to have my patient raise up her eyebrows so I can see where that movement ends. And then I always like to place a finger over that frontalis and that temporal fusion line, have them clench their teeth, and really ensure that I'm injecting all the way over with that width of the frontalis. As you can see, I'm nickel to dime size spacing apart on that frontalis. I am making sure that I am in the right plane of tissue, so I'm about half needle depth on all of these injections, and I'm working from one side to the other. Whatever makes sense to you is going to make sense to your patient. Whatever you do confidently, your patient's going to be able to tell in their injections. So overall, we're now moving on to the glabella. We just did a Perseris injection. That was a 90-degree injection right directly in the middle, and then we are doing the medial and lateral tails of the corrugators. This patient has repetitive treatment, so as you can see, she doesn't really have a lot of movement in this area. So I like to mark the medial corrugators, and then I really have them make an angry face so I can see those lateral tails. But on her, it is a little difficult, so I just stayed a little bit more medial for safety purposes. On that lateral corrugator, if you inject too deep and you don't know where that lateral corrugator is, you can hit the frontalis that is laying underneath that lateral corrugator. So make sure you're being safe. When in doubt, don't inject it. Always know your anatomy before you're injecting. Here we are around the crow's feet. As you can see, I had my patient smile really big, and then I'm really following that movement and where that muscle and that tissue is pulling the most. So I did a 3-point injection on each side. It doesn't need to necessarily be the same on each side. It just depends on your assessment. One side might have more wrinkles than the other, but use your best assessment and your best judgment while dosing that. Here we are doing bunny lines. Had my patient scrunch like a bunny for this. We're staying on that superior part of that nose in that cartilage. Here we are in those DAOs. I have my patient show me their bottom teeth so I can really assess that muscle. You want to stay more lateral than medial on the DAOs just because you never want to hit the DLI or your patient will look a little wonky in their smile. We also hit that mentalis. I had my patient make a pouty face for that, and that's just targeting any type of orange peel appearance of that muscle when your patient is animating. And then here we are doing a very light treatment in the platysma bands. A lot of her strength has been more up towards that jawline, so we're really aiming the heaviness of that dose up there and then tapering it down. As you can see, I like to mark all the way down the platysma bands. I have them express their face and make that E face, and then I grab up on that platysma band and isolate it while injecting. And then I'm genuinely just injecting every dot that I've marked. So as you can see, I'm pinching up that muscle, I'm injecting a little bit of product, moving down, repeating the process. Overall, with this dose, I pick my dose first and then I add saline to it in order to get a nice even spread throughout the whole entire neck. There is a lot of platysma bands in the neck, depending on the person. Some might be stronger than others. It's completely okay. Just really make sure that you're assessing your patient appropriately and making sure that you're getting that product to spread all the way throughout these platysma bands. Last is a lip flip. As you can see, I had my patient smile really big. We're staying very superficial on this injection. We are making sure that we're on that vermilion border of that lip, right outside of that border. We don't want to be too far out just because we want to really be isolating that muscle. When that patient smiles, we want to relax it so that the top lip doesn't curl in, and we just focus this dose on the top lip to give her the best result.